Okay. Whoa.
Okay. There's someone in the chat is asking about a call-in number. I believe that let me just quickly see if I can set it up. We'll just give.
I can post that, Jen.
Oh,
yep.
Thanks, Jenny.
Sure. And this would be for Canada, right?
I think so.
Yeah.
Maybe US as well. Okay. Just yeah, answer to Canada. Okay, so we're just still waiting on Courtney and Melissa, but I imagine they'll be here soon. I'm just going to give folks one more minute, and then I'll launch us off. Robin, if you have a minute, do you want to just message Courtney and Melissa and see where they're at? I think we can start while we're waiting for them, because I'm going to give a bit of an intro, and then I know we only have Yasin for the first half of this call, so Yasin can start if we're just waiting for Courtney and Melissa to join up. I also want to note that all three of our medical panelists are really involved with responding to COVID, like in the moment. So their availability and whether they get called away or not is a bit outside of our control. So hi, thank you so much for joining us. My name's Jen. I work with the Canadian Association of Physicians for the Environment, which is a member-based national organization that works on research and advocacy that's at the intersection of human health and planetary health. And I also do some work with the Global Climate and Health Alliance, which is an international organization of which CAPE is a member. And CAPE is hosting this webinar, and GCAJ has been kind enough to offer us tech support. So thank you both. I want to begin by noting that I'm here hosting this meeting from the unceded traditional Indigenous territory of the Huron-Wendat, the Haudenosaunee, the Anishinaabe, the Chippewa, and the Mississaugas of the New Credit. And I want to note that as all the things we're talking about today, all the topics we're going over, so like healthcare availability and access, changes in how we gather, and climate change impact, particularly in Canada, but also around the world, impact Indigenous communities disproportionately and differently, and that is something to keep in the forefront of our minds. And while this webinar will not touch on that topic because none of us are Indigenous, Indigenous Climate Action is hosting a webinar at 2 p.m. Eastern time, and if somebody has a link to that and wants to drop it in the chat, that would be fantastic. On Joining us today, we're fortunate enough to have Courtney Howard, who's an emergency room physician working in Yellowknife and also CAPE's board president. We also have Dr. Melissa Lem, who's a family doctor in Vancouver and who's a CAPE board member. And we have Yasin Cholikov, who's a public health resident in Montreal, who has been working on the COVID response since January. I also want to introduce Karina Keeling, who is a talented graphic recording artist who's going to capture the meeting like through drawing. If you're a visual learner and having the drawing is good for you, then you can keep it big. But if you find you're going to be distracted by it, what you can do is go up to the top of your screen where it says view options, and you get a chance to put it your screens side by side. And then once they're side by side, two little white lines will show up, and you can grab the white lines and move them over to shrink the drawing so that you can see the panelists bigger. I'm just going to quickly flip to Karina to say one more thing about how she's going to capture today.
Hi, everyone. Thanks for, can you hear me okay? Thanks for allowing me to be here to be of service to this conversation. This is an issue that I care about a lot. I just want to make sure everyone in this digital space understands that these drawings belong to you. I'm not precious about them. It's really about reflecting what happened here. My role is not to necessarily capture everything verbatim, but to sort of listen for the themes and what's rising to the surface and what's at the heart of the conversation. If you notice that I've made a spelling mistake or caught an acronym incorrectly, or if there's something that as a participant really grabbed your attention and really helped to sort of solidify and triangulate what we're talking about today, please feel free to send me a message in the chat and I'll do my best to include it.
Thanks. We're in really challenging and uncertain times. And I think like this group of people, the climate movement, are uniquely prepared to respond. We spend all our time thinking about the apocalypse, about thinking about these worst circumstances that we're now in. And we do that because we really care about the health of people and the health of the planet. And I think as we figure out, as the next weeks and months unfold, I think that we have the climate movement and organizations more generally have a very key role to play. We have, I think that we have incredible digital capacity. We have big lists. We have huge hearts, and we understand what it means to like move quickly and responsibly, thinking about inevitabilities and groups of people who sometimes get missed. So I think we're incredibly well prepared to respond to this. I think we have the opportunity to be part of the fight to keep multiple healthcare systems from crashing and thousands of elders and loved ones from dying. We are in a radically different world than last week. And this, I think, is a moment to build capacity for audacious empathy and altruism in the face of what we always knew was coming, really challenging things. So this is not the first or the only test, but it is a major one. And we have to respond by building the world that we want to see, by tying a safety net that is tight to catch as many people as possible. And sometimes that is going to mean staying home. So I think in this moment, we're gonna survive and ride this wave only if we open our hearts and care about other people and work together. And all of those things are things I learned how to do by working with all of you in the climate movement. So I'm so grateful you're here and that you're giving us your time. I'm going to flip it to the experts. I want to, for Yasin's time, do we want to start with Yasin, or Courtney, do you want to jump in on like why it makes sense to be on lockdown or on social distancing?
I think Yasin, as the public health expert, is best placed to sort of lay the scene out and give us a sense of what to expect. And then I'll go into what I'm seeing clinically and sort of what I think that means for messaging.
Awesome.
So should I go ahead?
Yeah, go for it.
So maybe kind of as a preamble to this, I won't do an extensive history of COVID. I think it's been all over the media. You kind of know what happened. Started in December in China, It's possibly associated to wet market, where lots of live animals were in contact with each other and in contact with humans. And eventually it's a disease that was transferred, a zoonosis that was transferred from animals to humans, and is now very readily transmitting itself between humans. I think that we've started taking steps all around the country since middle of January, I would say, maybe a bit earlier, a bit later in some places. And we're now at the point where we're taking very drastic steps, such as closing borders, limiting public gatherings, limiting certain types of social activities, or like going to school, like having basically large numbers of people getting together, because the idea behind that is to slow down the progression of the disease. It's a disease that without interventions that would slow down without intervention would probably affect anywhere between half to 80% of the population of any given jurisdiction. The symptoms, one could say that they are the majority of the time relatively mild, but the problem is that in about 15% of the cases, they become more severe and require care. So when you're thinking about 50% of a population requiring care, 50% of a population being affected and 15% of those requiring care, it starts to be very large numbers. Our hospitals, our healthcare systems are not designed to have to deal with that many people in such a short period of time. So this is the whole flattening the curve. You've probably seen those images all over the internet, all over the TV, and whatever other media you use. The idea is that you want, instead of having all the cases happen at once, you want them to happen slowly over time, so that as someone gets sick, we can treat them appropriately in the healthcare system that we have, and they can go home, and then when someone else gets sick, we're ready to take care of them again. Now, I think that some of the kind of very important things to emphasize is that there's basically two strategies that have been discussed around the world. So one of them is a sort of mitigation strategy, so trying to slow down transmission while acknowledging that there will be some transmission. And the other approach is complete lockdown of everything, suppression in a way. Unfortunately, the current modeling, or at least some of the current modeling that allows us to predict how things will go, show us that if we do mitigation, we will have lots of people dying because the healthcare services will not be sufficient. So the suggestion is that currently we have to all go in complete lockdown. So basically shut down contact as much as possible in order to avoid people dying because of lack of healthcare services. Because that's what's happening currently in Italy. It's people are practicing what could be qualified as war medicine and deciding who to treat and who they cannot treat because that person has a lesser chance of survival. This is not what healthcare providers want to be doing. And this is not what public health physicians who are asked about kind of ethical questions around how to attribute resources want to be doing either. So that's what we're trying to avoid here in Canada. And fortunately for us, I think that we've put into place at least many jurisdictions. We have to understand that we're a federated state, so every province does different things, but many jurisdictions have now put in place very intense social distancing measures that will, and we've done so a lot earlier than some of our European colleagues, so the impact will hopefully be lesser. I think that one of the important questions around this is how long will that last? And that's kind of a question mark. I think that the disease or the way a pandemic spreads can last for a very long time. Sometimes we say a year or 18 months. It's probably not tenable to maintain the very intense suppression measures for that long. It's interventions that have never been tried in modern society, and how basically people react to it is unclear. How societies react to it is unclear. Whether we're able to produce the things that make society keep going back to the very basic things such as food, water, electricity, whether we're able to maintain those things while still being in complete lockdown is unclear. So there's things that will be tried. Different countries will approach things differently. Some might reduce the social distancing measures and the restrictive measures as time goes, but that's still to be seen. Also, a little a fact around how long it will take us to see it. It's probably ranges around the 2 to 4 weeks, the delay in which we'll see the impact of what we've done today. So most provinces over the last week have taken a lot of measures. We won't really know whether those are working until next month at best, and maybe later in next month is a possibility as well. So it's more right now we're kind of holding the fort and hoping that things will go well. I don't know if there's anything else at this point that you wanted me to talk about.
No, I think that's awesome. Courtney, do you want to, and Melissa, do you want to talk a little bit about what that means for you, like on the ground?
Sure, I can go ahead and talk about what we're seeing on the ground in primary care. So obviously, you know, we're seeing a lot of people in our clinic who are scared. Doctors and healthcare workers here in Canada are already testing positive for the coronavirus. So we had our first positive swab at our clinic in Vancouver, where I work, late last week. We have patients who are starting to, you know, take supplies from our clinic. Our masks and our gloves and our hand sanitizer are starting to disappear. We have them on lockdown. And we also have healthcare workers who are kind of confused about the mixed messages and recommendations coming from different levels of government and even between provincial health officers. But on the positive side, what we're also seeing is that doctors and other healthcare providers in our clinic are calmly stepping up to support each other and also provide patient care in an evidence-based way despite a rapidly changing practice environment. We're also seeing kind of unprecedented levels of communication and collaboration between healthcare professionals and the administration at our clinic and across the province and country. Some people in this call might be part of 15,000 members in a Facebook group that was created 5 days ago for Canadian doctors to share and access information about COVID-19. And also our clinic and a lot of others across the country are shifting towards medicine and virtual care for their patients. Careful input. Physicians like our provincial health officers are really emerging and being praised by the public as being strong, compassionate, and trusted communicators.
Thanks, Melissa. Courtney? Sorry, Courtney, you're on mute.
There
we
I put
go.
together a super fast PowerPoint here. Do you mind if I try to share the screen here? Oh, can you give me the ability to share the screen?
I'll lose Karina's screen share.
Okay. Is that possible or?
Sure, let's try.
Okay.
Can you, okay.
Do you want me to try now?
Sure.
Okay, let's see. It says I can't.
Okay. Okay.
Okay.
Let's, can we leave it and then, because I'm sorry.
That's fine. So I am an emergency doctor up here in Yellowknife, and we have a really small medical community. And so what that means on the ground here is that pretty much everybody here, in addition to doing their clinical job, has a leadership role. And so what I'm seeing, so I've just worked the last 2 days, it wasn't on the schedule because somebody who came from another province has to self-isolate. So from a healthcare provider perspective, it's very, I think maybe in order for Karina, I think what needs to happen is that Karina would need to stop sharing and then I could take it over. I just saw a message from Erica Frank there. In any case, so what that means is it's exhausting because you're basically going to meetings before and after your shifts and then going to work your shifts. And so
you could share now, Courtney.
Oh, okay, great. And so what's happening is that all of my lovely colleagues that I love so much are getting really tired already. And so what view slideshow here? Oh goodness, I think this is the wrong one. Sorry, guys. Anyway, so I'm just going to go back a little bit to a health frame. So I think that something that can help us with this is essentially taking a look at what health is. And so I'm going to publish a version of these slides. So I'd appreciate it if people don't take screenshots, but just to let you know. So when we all went to school, we kind of thought that health happened in the hospital. And, you know, that's why we trained for so long to go to work. This is working from a screen share perspective, eh? Yeah, great. And what we've realized is that the ecological determinants of health, in fact, are super necessary for everything else that happens in society. So these could be things like oxygen, water, food, fuel, and even you could put biodiversity here and, you know, interactions with the natural world. So as Yasin said, you know, this pandemic has started with a uncontrolled, unproductive interaction with the natural world because we were coming up against these, the situation in the seafood market in Wuhan. And, you know, if those are stable, then that gives us the sort of concentrated resources to be able to build social networks, financial networks that give us the ability to create things like roads and schools and universities. And, you know, many of what we refer to as the social determinants of health, you know, are generated from those networks. And you can see that they're supported by those ecological networks underneath. And if that's all going really well, we can, you know, make a hospital, which, as you can tell, is a super, you know, a lot goes into that in terms of materials, construction, know-how, engineering, and then you have to staff it with really smart people. And so from a something that makes you feel very humble as a doc is that really all of that healthcare system is only responsible for about 20% of health, but in order to even have it, everything else has to go well. And so, you know, for many people on the call, we have been really focused over the last few years on, you know, climate. So there are many ecological determinants of health. And if you look at this sort of as planetary health frame, you can take a look at them as, you know, different planetary boundaries. So those are things like water or climate or biodiversity or nitrogen and phosphorus flows. And we've all really focused on the climate as the real priority. But in fact, it is more complex than that. And so I think what we're going to need to do as we move forward in order to meet audiences where they're at is acknowledge sort of a little bit more of a greater complexity and how what's happened in this pandemic fits into what, you know, we've already been talking about. And, you know, I think that you know, I made this with the climate in mind. And one of the reasons I've worked on this so much is that I'm very, very motivated to have a well-supplied healthcare system. And having worked in the developing world where sometimes, you know, the pharmaceutical cupboard is bare, I've thought a lot about things like supply chains. And we can see that this has actually posed a challenge to supply chains because we have single source just-in-time supply chains. And so because we have such an interconnected world and healthcare structures are some of the most complex, you know, it means that we have lost the resilience that maybe would have been ideal for us to sort of be able to weather something like this. And so I'm just going to go into a little bit of mental health here. And this was all done with eco-anxiety in mind, but I think that a lot of it applies to this current situation as well. And we really need to take it all into account. What I was seeing in the Emerge yesterday, the police came in. At one point we have a small department. We had 3 RCMP teams in the department. And please don't report that externally. But what it means is that people are struggling. So this is a moment of real worry, uncertainty, fear for people. And what I was noticing, if you think about it in the, if anybody has kids and they have that bucket, does anybody have that bucket book where it talks about what things you can do to fill up other people's bucket and what things take energy out of people's buckets? And it encourages kids to do loving, kind behaviors that fill up people's buckets. What I'm noticing is that people already are feeling like their buckets are kind of empty. So I was much shorter with people than I usually am at work yesterday, and pretty much everybody is. And so it's one of these situations where people are already coping with a lot. And so I think something we all need to really do is to take care of ourselves. So to do all of that self-care stuff the eating, the sleeping, the trying to make sure you exercise. I know it's hard, particularly for people who usually go to the gym or who do things, do classes where they need to make up a new workout routine. There are some good online videos. So beachbody.com is one that a lot of us in the subarctic use, because we, it's not always appealing to go out to the gym in -30. And so, that's a for-profit site. Apparently Nike has a lot on their app that you can do. But really, that self-care is super important to make sure that we have enough energy in our bucket that we can buffer some of the inevitable fragility that we're going to experience in the world around us. And so, this is ecological grief. Who knows what the word is going to end up being for loss of expectations of the way society usually goes. I'm sure there's a name for that. But when we look at how, societies have coped in the past, with difficult things, taking action is part of it. So this notion of a constructive, unpleasant emotion comes out of work that Dr. Greg DeBoer does often at the Family Medicine Forum. And he talks about, when you get anxious about a situation, the thing that is best to do is to treat it as a constructive, unpleasant emotion and to act. And so, action alleviates anxiety. I've had this slide in my presentation for years, and it's by far the one that tends to resonate with the most people. And, there's finally a little bit of evidence now that shows that this is actually evidence-based. And so I think that what a lot of people are feeling right now is that desire to make a plan. And so I think that what we're needing to realize right now as a climate community and a health community is that what we've talked about in terms of our meta narrative probably needs to shift. So we know that as much as we love stats, and if anyone's ever gotten a document from me, there'll be like 1,000 references there. But the bottom line is that people do things as a result of their feelings. And so this is a slide that Marshall Gans puts out. I love this. So he talks about action inhibitors and action motivators. And so we look down there at the different action motivators that overcome the inhibitors. So these are the things that when you think about how we often campaign or how we talk, even as clinicians, these are ways that we motivate people. So we'll often motivate people with urgency, we'll motivate people with anger, with a feeling of hope, with a sense of solidarity, and with a sense of you can make a difference, which is, a positive example of change making that somebody has already given. And I think what's really important as we move forward right now is to very carefully choose the action motivators that we're going to work with in acknowledgement of where our population is at with their bucket. Because some of these are the kinds of things that could potentially withdraw energy from somebody's bucket. And if people aren't coping well already, they're just going to want to tell us to stuff it. And so I would really invite people, as they're considering their next moves and their messaging and their action items, to see how we can be operating down here. So how we can be telling stories of hope, how we can be telling stories of solidarity, and how we can be telling stories with the idea that you can make a difference. So this is I'm an excellent artist, as you can tell. So, very, very practical ways that we can all help to fill up our own bucket right now, as well as other people's buckets, are with love, caring. I had a patient, and I tweeted this out, and I think it's fine if people know. So I had a patient who was very disruptive in the emerge yesterday. I couldn't get anything done because he kept coming. He was just, it was difficult in the midst of, you've already got too many patients there. And as I left, he, had his needs taken care of, and I was leaving on the sidewalk, and he said, "Thank you for surviving me, doc." And it just made me smile, because he had, at the time we were interacting initially, he didn't have enough energy in his bucket to cope. He didn't have enough energy in his bucket to be the person he wanted to be in the world. And then after we gave him something to eat, and we treated his pain, and we treated his anxiety about his underlying condition, and we showed him some love and some patience, he all of a sudden had enough energy in his bucket to share sort of thanks with me in a humorous way that acknowledged that, you know, he could have done it differently. And so what we did helped him to re-become the person he wanted and needed to be in that moment. And so how can we make sure that we're doing that with other people? Because if we're wanting them to be acting from their best selves, I think that this is really something we need to do. And so when you think about the things that are on the left, and, you know, I just drew this in 6 seconds before we started here, people are really coping with all of this, and we haven't even gotten into bereavement. So, you know, I've worked with Doctors Without Borders. I've had a lot more patients die under my care than many Canadian physicians, and it's very, very difficult. So we're about to take, you know, if we follow the pathway from other countries, we're about to take a group of Canadian healthcare providers who haven't had that experience for the most part, and they're about to have a life-changing clinical period. And that's going to be happening in the context of, you know, that happening for the whole population. So we are, you know, maybe this won't happen, but I had a call with my friend who works for Doctors Without Borders in France in charge of epidemic control yesterday. And she specifically asked us to start thinking about end-of-life care, because she's been taking care of the situation in France and in Italy, and actually in many African countries who have far less in terms of resources than what we have to be able to manage this situation. And she said, look, you need to start having these conversations around end-of-life care, around resource utilization. I saw that there was a National Post article about that yesterday. So how do we have fair and equitable conversations around resource utilization? Because it comes down to the fact that we have, for instance, 9 ventilators in the territory. I thought we had 12, but we counted again, or, you know, the ones that are working and ready to go right now are 9. And so in my critical care communities, there's conversations. Can we splice different ventilator tubes one to the other? Could that work? Would that work if you have patients of different sizes? So these are the kind of conversations that critical care doctors are having. And so, you know, many smart people are working extremely quickly at this right now, but the likelihood of a perfect outcome is very low. And so how can we start really actively taking care of one another and really actively being incredibly kind and just really actively trying to come up with a narrative that helps us all fit this together in a way that increases our sense of unity and our sense of solidarity and our sense of that heroic nature of coming through a difficult time in history together. Because when we think about the life-changing moments of other generations, you know, the First World War, the Second World War, those weren't fun periods, but those are the moments that make a generation. So how can we come out of this? What can we do now to make this an experience that was horrible, but that left us feeling more united and proud of ourselves? Because that is the group we need to be heading into when we all have bandwidth, when the world has more bandwidth, to solve the climate crisis. And so some narratives, this is like horrible, but this is just emails that we've been putting back and forth. But some of the main messages that we've been talking about are, you know, we are all in this together. So in 2020, health is planetary. So that takes into account both climate change and the zoonotic origin of this pandemic, and takes into account humanity and the natural systems which surround and support us. Inequality and a lack of access to care hurt everyone's health. So if, you know, more countries had been able to access swabs in time, it would have been easier for us to you know, control this pandemic in a better way. And lives are saved when we listen to experts. So, you know, we've had a sort of anti-science bias over the last little while. Those messages have been winning. So how can we double down on this? You know, we are saving lives by listening to experts, so that then, and I wouldn't even connect it to the climate crisis now. I don't think people have bandwidth. They're so preoccupied with what's going on. You'll notice there's no word climate in those first 4 words there. I think really dialing it down for the most part for external audiences is going to be helpful, because their minds just aren't there, and act within the time windows that they recommend. And when we work together, we can change the world quickly. So I was talking to a doc at work yesterday, and he said, well, you know, what I am liking around the climate and communications is the good news. So I think that making asks of people from a climate perspective right now might overwhelm them. But when we say, hey, you know, it turns out that as a bonus that air pollution is way better in all of these cities as a result of the lockdown, I think the good news stories could be helpful. And ideas for action. So how can that climate community be part of this moment of helping a whole generation find their best selves and rise to the occasion? I mean, when we think about the world, there's been so much Instagram superficiality that I think a lot of people are looking for a moment like this to rise. And so how can we help be that? And so really practical things, like I had a nurse come into work yesterday who went and slept all day in between night shifts because her kids were at home. And so usually they're somewhere else and she can sleep. Like childcare is a really big deal. So how can we harness the digital organizational capacity of the climate movement to help provide childcare for healthcare providers? How can we start to codify and count the temporary changes that we're seeing right now in terms of virtual care provision in healthcare and in virtual meetings? So I've got a proposal sort of building for counting the number of carbon emissions we're saving in the NWT healthcare system. How much money is that saving? How can we just launch right into something to propose to policymakers? And how can we identify what's really working at the community level in terms of building resilience? Because we know we have a mitigation sprint in the climate world. We also have an adaptation sprint. I mean, Canada's Changing Climate Report told us that we were going to have, we're looking at about 2 degrees Celsius more warming by 2050. So how do we make sure that we're harvesting the best practices in terms of crisis management and response that are happening now at the community level in that sort of transition town space, so that we can tell those stories and then scale them? And then, you know, this will be a huge moment for reinvestment, and there's a real risk of crisis capitalism taking over here. So what is our counter ask? And I think a lot of that work's already been done, but how can we reframe that? And so as an extension of the divestment movement, moving to just a really strong reinvestment, this is the world we need to build coming out of this moment of crisis. So thank you for listening there, and I'll stop sharing, and yeah, looking forward to more discussion.
Thanks, Courtney. Yeah, thank you so much for that, really working us through the place we're at and where we're going. I think we heard in Courtney's presentation that like this, that there's going to need to be sensitivity about when the rest of the world, and particularly healthcare providers, are going to be willing and able to listen to messages about climate change again. Really briefly, some of the things that I know that we are starting to talk about in the health sector are the ways that like COVID is directly linked to and caused by climate change. And so I'm only going to mention these so you have them in your heads, but I'm not suggesting, particularly given what Courtney just shared with us, that we start talking about them now. But I think like some of the three that are rising to the surface are habitat destruction brings animals and people in closer contact, and that leads to the types of zoonotic infections like we're seeing, that like COVID that we're seeing. There's also instances where air pollution from fossil fuels exacerbates people's lung conditions. So people are in less good health than they would have been to begin with, and those are the folks who are susceptible to things like this. And while COVID isn't directly related to temperature rise, there is evidence that other vector-borne diseases and some infectious diseases will be possibly increasingly likely as the climate shifts. So that there are eventual connections to be made there. And I would say like not quite watch this space, but that as the health community drills down into those, we'll do our best to share those with this broader community. Melissa, I wanted to flip to you to talk a bit about nature-based solutions, both for managing some of the like stress that people are under, and also getting back into sync with the natural world.
Can I share my screen as well? I have a couple really quick slides here.
Yeah, you should be good to go to share it.
Okay. Can everyone? Okay, can everyone see, I guess, this slide here? So I just want to talk about a couple of really quick ways, like being a primary care provider and seeing patients every day. These are two things I think we can speak to right now that I don't think we'll get a lot of pushback, as Courtney was saying, about positive ways that we can speak about working on climate change and this at the same time. So one thing that our provincial health officer has said, she said, well, we have a lot of things that we can do outdoors, which are very safe things to do. So go outside and play with your family, go out and experience what we have there in British Columbia right now. So there's a really huge body of evidence indicating that spending time in green space is really good for both your mental and physical health and boosting your immune system. And certainly, now that gyms and libraries and cafes and all the places that we normally recreate and sort of socialize and reduce our stress are closed, nature is really open 24/7. So I think what we can do right now, and which is being reflected by some of what I'm seeing in the media, is to encourage people to get outside into nature and advocate for abundant, safe, and accessible green spaces in our neighborhoods and across the country. So we're saying it's safe to get out by yourself. It's safe to get out with your families, like with your immediate family. So that's one thing that we can do. The UN Environment Program has actually said that that connecting to nature, or kind of advocating or fully embracing nature-based solutions for climate change, which focus on protecting and managing and restoring our natural ecosystems, can get us 30% of the way towards reaching our Paris Agreement targets by 2030. So I think this is one thing we can push forward. And I think we also need to underline the importance of sort of investing in active transport infrastructure right now. So I've seen in the media, a lot of people are turning to active transport now that different governments and are recommending that people stay off public transit, especially during peak times, to reduce transmission. And so in fact, New York City's Department of Transportation announced last week that it's seen a 50% increase in bike traffic on the bridges connecting Manhattan to Brooklyn and Queens compared to last March. And their city bike share program has, their rides have increased up to 67% compared to a year ago. So not only are there sort of health benefits of this, but there are also, climate benefits and keeping people away from COVID right now. So I think these are two things that we can really push forward and amplify right now, is spending more time in nature and protecting our natural spaces, and also making sure that we have very strong and safe kind of active transport corridors to get people around at this time. And sort of as a side note, I think we may have touched on it a little bit, but I want to underline the importance of us advocating for public and widely accessible wireless and digital infrastructure. And I think in some ways this speaks to the social justice aspects of it, because people with low income who right now are relying on the internet through libraries and cafes, they're going to be less connected now more than ever. So I think by emphasizing how important it is for us to have strong virtual connections, it can also kind of underscore our need to move more of our meetings virtually and fly less.
Thanks, Melissa. So I think we've heard from what we're hearing is right now in the immediate term is like this question of can the climate movement use the digital capacity that we have to assist in flattening the curve, in doing the kind of messaging around community care and building support networks to provide care for children of doctors, to mobilize resources so that folks who've lost their jobs or folks who have to stay home aren't falling through the cracks and into desperation, as we deal with like what is likely at least the next 2 months, if not longer, of extreme uncertainty. So I think we have this opportunity to push for measures right now, to also, as we're pushing our governments in various ways, to push for measures that lay the groundwork for climate solutions later. So if we're doing any activism around trying to bring in the kinds of like monetary supports to support people to stay home or for childcare, doing that this community can do that with a mind to laying a groundwork for a post-crisis push to have people be supported better. So I think, just my humble opinion is that us showing up for our communities in a way that allows us to keep people as safe as possible is our strongest play right now. And that's not to say we can't have an eye to July and August, getting ready to sort of like figure out where we go from here back in the world of climate change. I wanted to, like, between our panelists, I wanted to, if there was anything else, other suggestions you had of things that the climate movement can be working on right now, either from a messaging standpoint or a campaign standpoint that you think would be useful. And Karina, we could get Karina, I think we could get you back up if you're game for that.
I think the really important thing we need to work on is a new meta narrative. So we've been working with this sort of the world is on fire, act now kind of meta narrative. I don't think people coming out of a pandemic are going to be able to cope with more of the world is on fire. They're going to be like, and I'm going to escape now to, you know, a golden age of Hollywood movie, which is why those were created, right? And so I think that, you know, that's something that people can easily be doing, you know, in sort of focus groups internally, really working on that meta narrative and then seeing what kind of action items stem out of that. And then from a practical perspective, childcare and really harvesting those stories of resilience at the local level. It'd be really neat to pair with some qualitative researchers at some of the universities to do that. So if, you know, the climate movement could help set up the digital architecture for that, and then we could find some, there's lots of great qualitative researchers in Canada, and then we could actually get some publications that really help delineate what worked in crisis, in community. I think that'd be super helpful.
I'm going to jump in here and mention, in terms of what I've seen on the ground as a physician, just that people, they seem to be more sure of how they need to act when they have a consistent and a centralized message delivered by compassionate and clear communicators like our provincial officer of health. So in the future, I think if different stakeholders from climate to healthcare organizations can connect and decide on and push out the same message at the same time, you know, even if it's on, say, a monthly basis, you know, while giving organizations the space to implement these messages, I think that could be a really effective way to mobilize the public and move forward. I know that, for example, our provincial health officer, Bonnie Henry, has been sort of held up as this clear, focused, compassionate voice at this time. So I think coordinating our message and pushing kind of a central message out could be a really powerful way for us to move forward.
Thanks. I want to, we have, somehow we've ended up with a little bit more time than I thought we were going to have. So starting with Yasin in case Yasin has to jump, and then Melissa, and then Courtney, just if there's like anything else you want to add in the last 5 minutes.
I'm wondering if people have questions in the box that maybe we could address. Anyone have questions?
The questions that I'm seeing in the box, one of them is if someone could write down the name of the Facebook doctors group so that folks can see what that is. Courtney, you mentioned it. It had like 15,000 members supporting right at the beginning. Or Melissa, someone mentioned this large Facebook group of doctors.
I'll paste it.
Great. The next question is, we're looking for protocols, routines, mechanisms to look after medical personnel during the emergency so they can stay well and don't burn out. Anybody know of these?
So protocols for healthcare workers, really, like, what I'm seeing is people aren't getting enough sleep. They are, because what's happening when you go to work is that every single day the procedures are all different. So you can imagine if you, I mean, everybody's trying to work from home from now. So imagine like showing up at work and somebody comes to you and is like, actually, we put the masks over here, and if you want to see this patient, you have to put all your stuff on and then leave your chart here. Oh, whoops. So the everything is changing, but none of the processes have been, they're not perfected yet. And so every day is a new draft of processes. And so you can imagine how crankifying that is. And so people, in the context of not enough sleep, not enough exercise, not enough childcare, worries about like staffing is changing day by day as people get stuck or they get sick. And so just really like support with the logistics of everyday life for healthcare providers would be super, super important. I haven't heard anybody say yet that they don't have time to cook, but I'm sure at some point groceries are going to run out. So that kind of thing would be really helpful. And you know what, I just want to say, I've seen a lot of messaging and I'm seeing a little bit in the chat box. I've seen a lot on Twitter in the yes, but frame. So yes, we need to pay attention to the pandemic, but don't forget about climate change. I think that kind of messaging right now is not helpful, to be really honest with you. And I know that sucks. And maybe I'm a N of one target audience that is like maybe this is just my opinion. But when I hear that in the context of what I'm already trying to do, I literally want to, I like can't cope. And so you all know how much I care about this. And so I just think we really, really, really need to be super careful to be meeting our audience where they're actually at. I think there probably will be a subset of people who are at home who are, you know, they've got time, they've got capability, and they're there and they want to work. And so I think that some of that communication maybe needs to be more internal. I think right now, because we haven't even gotten to the place where people are losing their loved ones in Canada, but we're going to get there. And so we need to be really careful about that messaging. So that technique of tying it to the pandemic and then saying, but you need to care about this, think again about people's buckets and where they're at and how instead maybe you could do something that could help fill their bucket up so that we get them to that place where they can cope, where they're having a positive experience right now that makes them feel as though we are enough. Because if we say yes, but what we're saying again is you're not enough and you're already trying so hard. Okay, so I think this is a matter of timing and I think it's a matter of audience, but just be really, really careful about it.
Thanks, Courtney. I think, so we're getting lots of questions about where this video recording will be available afterwards. Between Cape and Sarah from, there you go, Sarah's just answering the chat. We're gonna do our best to make sure that you get that. We have everybody's emails. I think, just echoing what Courtney said, I think it's totally okay to make observations that internally, that way more meetings than we thought and way more conferences than we thought could happen online. Those are important things to notice. And I think they're things to think about how we work on them in the narrative, again, months down the road when people have more emotional space. Of like the whole, as we've been thinking about this, I just keep thinking about this thing that happened when I was a kid. My mom, my sister's 4 years younger than me, and she always wanted to play with me, and I found it very annoying. And one day she came home very upset that her friend's younger sister had wanted to play with her. And I said, hey, like, now you know how I feel. It's no fun. And then she burst into tears and got very angry and wouldn't speak to me. And my mom pulled me aside and said, you know, Jennifer, when somebody's having their own intense emotional experience, it's really not the time to make a point. Because mostly they won't hear you. And it's also not very compassionate. So I think leading with compassion and with empathy and with the best parts of this climate, of this movement, the best parts of the people who have dedicated their lives to protecting human and planetary health. That is who is on this call. And so how do we leverage that care to support the best outcome for as many people as possible? Yasin, anything that you want to throw at us?
I was going to share another story, but I think that's actually a nice conclusion one, so I would leave it at that.
I want to share one more thing if I can. So I just want to emphasize to people that let's not get too lost in our virtual worlds. You know, I know a lot of people's anxiety spikes when they spend hours, you know, on Facebook or Twitter or whatever, scrolling through all the scary stories about COVID. Let's make sure, you know, that we take the time to spend time with our families, to spend time going outside and even maybe connecting with each other, you know, on our phones while we're on a walk in the woods or while we're on a walk outside. Let's take care of our mental health right now and not forget to disconnect while we're so focused on this right now.
Thank you. Okay, I want to thank you all for joining us today, all of the attendees, and certainly all of the panelists. Thank you so much for giving us your time. I know that you are doing patient care and doing broad structural messaging, and so thank you very much for sharing your wisdom. I really appreciate it.
Thank you to everybody for your interest and all the good work you already do and that I know we're going to do together. I mean, this is changing the world. This is a societal flip. So now we wanted to be in a new place. This is not the new place we wanted to be in, but we are in a place where we can move forward in a very, very new way. So I think if we do that with the most compassion, the most patience, and just really taking care that those actions come from a centered version of ourselves, which is going to take self-care in order to be that person, I think we can end up with a world we can be really proud of. So thanks.
Thank you very much. On that, I'm gonna close us out. Thank you.